cortisone shots. Are they effective? They can be. What's the risk? Is there a risk? So let's look at joint mechanics from a mechanical model, from a musculoskeletal perspective. Joint inflammation or arthritis, that's all arthritis is joint inflammation, occurs when a joint is under too much stress. And this happens because the dynamics of the body aren't supporting the structure equally. And so there's too much stress on a particular joint. This creates wear, extra wear, and two, the joint becomes fixated, meaning it's not able to move properly. What happens then? You're not being able to get in your nutritive fluids into the joint, and fluids can't escape. So you have a twofold process. There's too much wear, and the body's not being able to penetrate that joint with what it needs to heal. So you get this chronic inflammation cycle where the body's constantly trying to heal the joint and never able to. Ultimately, the joint degenerates because it's not being fed. And then sometimes this works. The body begins to build bone around the joint to stabilize it. It works for a time. Here's the downside. You're going to lose range of motion. That joint is no longer stable as it ought to be. And in the case of the spine, the nerves are also affected. And this is what makes chiropractic such an amazing modality. We're removing interference in the nervous system. The brain is being able to talk to those muscles properly. We're introducing benefits to your range of motion. That's great. And we're inhibiting arthritis, and a moving joint arthritis is going to be able to set in. On to our cortisone shots. The Radiological Society of North America is meeting today to discuss, there being two presented recent studies that show that over 2 years, in a study of those who were injected with cortisone and those who were injected with hyaluronic acid, that 2 years later, those injected with cortisone showed more severe joint deterioration. What is hyaluronic acid? Hyaluronic acid is produced by the body, and it helps your cartilage resist compression. So there's a definite difference with cortisone. Now, what do we want to do? Can cortisone be effective? I've had patients that have exhausted every conservative treatment option that they had available and were able to get relief from severe pain with a cortisone injection. But you want to be aware of the risk. Is the relief going to be worth a faster progression of arthritis in that joint? And if the answer is yes, then you need to move forward. But you have to be able to weigh those risks to really make an informed decision. What we want to do moving forward, though, is analyze the feet. Are the foot arches supporting the body, supporting the pelvis? Is the pelvis level? Are there multiple subluxations within the spine that are inhibiting your brain's ability to communicate with your muscles and tell them what to do? So there's some things to be weighed here. I hope that gives you a good perspective when you think about cortisone shots.